We will be discussing about carpal tunnel syndrome. In this video, we will have an introduction to the carpal tunnel syndrome, anatomy of the carpal tunnel, and the causes of carpal tunnel syndrome, the clinical features or stages of carpal tunnel syndrome, the clinical tests done in this condition, the treatment options which are available, and in the end of this video, we will also discuss some clinical questions and MCQs from this section. So, first we will have an introduction to the carpal tunnel syndrome. So, introduction. So, the carpal tunnel syndrome, the term was coined by Maurice, and the condition was first described by James Paget. That was in 1854. So the carpal tunnel syndrome, it is a group of symptoms which are arising due to compression of medial nerve in the carpal tunnel. So it is an entrapment neuropathy. Entrapment neuropathy of medial nerve. So it is most commonly seen in the age group 25 years to 75 years. Men and women are affected. So the presentation, most common presentation is tingling, numbness, and paresthesia. And pain, which is worse at night. So it is an entrapment neuropathy of medial nerve due to compression of medial nerve in the carpal tunnel, and this most common in the age group 25 to 75 years. Most common presentation is pain, tingling, numbness, paresthesia. The condition was first described by James Paget in the year 1854. And let's look into the anatomy. So we'll look into the carpal tunnel. So the carpal tunnel is surrounded on its three sides by the carpal bones. These are the carpal bones. So it is surrounded on the three sides by the carpal bones. So this is carpal bones. And other side is formed by the transverse carpal ligament. So three sides are formed by the carpal bones, and the other side is formed by the transverse carpal ligament. So the floor of the carpal tunnel is formed by the osseous arch formed by the carpal bones. So the osseous arch of the carpal bones forms the floor of the carpal tunnel, and the roof is formed by the transverse carpal ligament. So floor is formed by osseous arch formed by carpal bones. And the roof of carpal tunnel is formed by transverse carpal ligament. And it consists of 9 tendons and median nerve. The 8 tendons are enclosed in a single flexure sheath. The 9 tendons are enclosed in a single tendon sheath, that is, 4 tendons of flexor digitorum superficialis. These are the 4 tendons of flexor digitorum superficialis and 4 tendons of flexor digitorum profundus. Four tendons of flexor digitorum profundus. So these 8 tendons, that is the 4 tendons of flexor digitorum superficialis and 4 tendons of flexor digitorum profundus, are enclosed in a single sheath, and the tendon of flexor pollicis longus is enclosed in a separate sheath. This is a tendon of flexor pollicis longus, and we have the median nerve as the content of carpal tunnel. This is a median nerve. So the contents of carpal tunnel are four tendons of flexor digitorum superficialis plus 4 tendons of flexor digitorum profundus plus 1 tendon of flexor pollicis longus and median nerve. These 8 tendons are enclosed in a single sheath, and the single tendon of flexor pollicis longus is enclosed in another separate sheath, and there is median nerve. Totally there are 9 tendons and a single nerve in the carpal tunnel. Now we will discuss about the causes of carpal tunnel syndrome. For this, we are having a mnemonic, that is pragmatic. So P stands for pregnancy, R stands for rheumatoid arthritis. A stands for arthritis of the carpal bones. T stands for growth hormone abnormalities. Like acromegaly. M stands for metabolic causes. Is include diabetes mellitus, gout, hypothyroidism. And A stands for alcoholic use. T stands for tumor. I stands for idiopathic causes. C stands for connective tissue disorders. Like amyloidosis, this is another cause. So connective tissue disorders and amyloidosis can be causes. So this is a mnemonic for the causes of carpal tunnel syndrome. Now we will discuss about the clinical features. Clinical features can be divided into 4 stages. Patient can present to you at any stage. So, third stage and the fourth stage. In stage 1, the patient will be having pain and it is not localized to the distribution of median nerve. Patient is having pain which is not localized to the distribution of median nerve. Pain not localized. And at the second stage, the patient will be having pain, tingling, numbness, paresthesia, along distribution of median nerve. So it is a localized pain, tingling, numbness and paresthesia. So at the third stage, the patient may have clumsiness of hand, and loss of digital functions. Loss or impairment of digital functions. So at the fourth stage, the patient will have sensory loss. We know that the median nerve supplies the lateral 3.5 fingers. So sensory loss along the lateral 3.5 fingers. On the palmar aspect, and distal phalanx of lateral 3.5 fingers on the dorsal aspect. And the patient will be having wasting of thenar eminence. These are the stages. So the patient can present you at any of these stages. So remember, if the patient is having sensory loss or wasting of the inner remnants, the patient is in stage 4. Next we will discuss about the clinical test. So these clinical tests which are specific to the carpal tunnel syndrome include provocative tests. So we are using some provocative tests in this condition. So the first one is the phalen'stest. And this is the most sensitive provocative test for carpal tunnel syndrome. So in this, the patient is asked to flex the wrist actively, but it should be unforced. So the patient is asked to flex the wrist actively. So if the tingling, numbness or paresthesia like symptoms are produced within 60 seconds of flexion of the wrist, the test is considered to be positive. So active flexion of the wrist produces symptoms in 60 seconds. And the second test is tourniquet test. So in this case, we tie a pneumatic blood pressure cuff on the arm of the patient above the elbow, and we raise the pressure to above the systolic blood pressure of the patient. And if this produces symptoms in the patient, the test is considered to be positive. So in this case, we are tying a pneumatic cuff and we are inflating the cuff to above the systolic blood pressure of the patient, and if it produces symptoms, the test is considered to be positive. Other provocative tests include median nerve compression test, so in which we compress a median nerve at the wrist. So if this action produces tingling, numbness or paresthesia, the test is considered to be positive. And the other test is median nerve percussion test. So in this test, we will use a percussion hammer and percuss the median nerve at the wrist. If this is producing symptoms in the patient, the test is considered to be positive. So these are the 4 provocative tests or clinical tests for carpal tunnel syndrome. Among this, the phalen'stest, that's the most sensitive test for carpal tunnel syndrome. Next, we will discuss about the treatment options which are available. Treatment. So at early stages, if patient presents to you, the patient isn't just having a pain, numbness and paresthesia, no functional loss, we will first start with NSAIDs. non-steroidal anti-inflammatory drugs. If the patient is not improving, we can start on steroids also. So the steroids we use, prednisone can be used. So we can use steroids for 8 days. First day, second, third, 4, 5, 6, 7, 8. Total 8 days of steroid therapy can be used. The first and second day we use 40 mg prednisone. So every third day we will taper the dose by 10 mg. On the third and fourth day we are using 30 mg. Fifth and sixth day using 20 mg, and the seventh and eighth day 10 mg. Then we stop. So if the patient is having intermittent symptoms, less frequent symptom, and no sensory loss or wasting of the inner eminence, no wasting, we can use another therapy, which is the injection therapy. So if all the above measures fails, so that is if the medication is failing, or the patient has sensory loss, or wasting of the inner eminence, we use surgical therapy, open surgical therapy. Which is the release of flexor retinaculum and transverse carpal ligament. To relieve the pressure on median nerve. So there is also an alternative therapy in carpal tunnel syndrome, which includes CHO's technique. CHO's technique is an endoscopic release of transverse carpal ligament. Transverse carpal ligament. This has a success rate of 93.3%. So these are the treatment options available. First, if the patient is in stage 1 and all, we start with non-steroidal anti-inflammatory. If the patient is not improving, you can also start him on steroids. We use 8 days of therapy. If all the medical methods fail, or if the patient is having sensory loss or wasting of the inner muscles, we use a surgical therapy, which is just a release of flexor retinaculum and transverse carpal ligament to relieve the compression on the median nerve. There is also another alternative technique known as CHO's technique, which is an endoscopic release of the transverse carpal ligament. Now we will be discussing a clinical question and some MCQs for this part. Here we are discussing our clinical case. The clinical case is a 40-year-old diabetic woman presented with sensory loss over the lateral 3.5 fingers and wasting of thenar eminence. Patient gives history of pain, tingling, numbness and paresthesia over the lateral fingers for last 8 months. The symptoms worsen with the flexion of wrist. What is the most probable diagnosis? From the history and the worsening of symptoms with flexion of wrist, all this point towards the carpal tunnel syndrome. So the diagnosis is carpal tunnel syndrome. So which nerve is involved? Definitely median nerve is involved. And the patient is at which stage of disease? It is mentioned that the patient is having sensory loss of a lateral 3.5 fingers and wasting of thenar eminence. So the patient is in stage 4. Clinical tests used to screen for this condition, which includes the phalen'stest, the median nerve compression test, the median nerve percussion test, and Tourniquet test. Treatment of choice in this patient. Since the patient is in stage 4, we use surgical therapy. That is, just release of flexor retinaculum and transverse carpal ligament. What are the causes of this condition? We mentioned the causes using a mnemonic, that is pragmatic. Now we will discuss few MCQs. A patient with the carpal tunnel syndrome has sensory loss over lateral 3.5 fingers and wasting of thenar eminence. What is the treatment of choice? Mentioned that sensory loss is there and there is wasting of thenar eminence. So the patient is in stage 4 disease. If the patient is in stage 4 disease, we will definitely go for surgery. And then the question is, most sensitive provocative test to screen for carpal tunnel syndrome is? That is definitely phalen'stest. The next question is, suture not passing through the carpal tunnel. So we know that the 4 tendons of flexor digitorum profundus, 4 tendons of flexor digitorum superficialis, and the tendon of flexor pollicis longus and median nerve passes through the carpal tunnel. So the only structure not passing through carpal tunnel is definitely ulnar nerve. So how many tendons and nerve pass through the carpal tunnel? The answer is 9 tendons and 1 nerve, that is the median nerve. So thank you for watching this video. To see more videos from our channel, please subscribe our channel. Thank you.